So good evening. You know what I want to make sure, first of all, is that you have a handout that Karen printed in color for you. Did everyone get this? There's 2 copies. I wonder, can we pass those around, Karen? That'd be great. Because what I have for you is a list of recommended websites about complementary therapies. So that's my job tonight, is to welcome you and provide some information about complementary or integrative care, or what we call integrative oncology. And so what that is blending the best of all medicines so that you feel better each day. And when I say the best of all medicines, we're pulling from conventional care, which is what you get, kind of the state-of-the-art service here, chemoradiation, special pharmaceutical applications, etc. But what about Ayurvedic medicine from India? What about traditional Chinese medicine? What about Japanese Kampo herbs and ways of meditation theories, etc.? So I want to provide you with information of about 21 therapies that I've reviewed. And I do this, a similar lecture, every month at the auditorium next door at the Tom Baker for the newly diagnosed. So most of you are way past that, but there is, in the review I have done recently, I update this talk. I must say I've been doing it for about 9.5 years next door at the Tom Baker. And every 3 months I review the clinical trials to see what's new in integrative oncology. So I have some really good information for you, I promise. So I'll talk about those sheets when they get passed around. Let me go back here. So integrative healthcare, yeah, you know what? I trained as a kinesiologist, so I was an exercise nut when I was younger, not so much anymore, for sure. But I worked in cardiac rehab, did my master's in cardiac rehab, and then the PhD comes from the US in integrative healthcare. So I want to tell you what integrative healthcare is. And it's really a way of looking at the whole person. When you talk about getting better, you need a healing plan for all parts of you, not just the prostate. I mean, it goes without saying. You know that. And your loved ones too. They need a healing plan for themselves to feel better while you're both, or all of you, your family is dealing with a chronic illness like cancer. Okay, so focusing on the whole person, your emotional life, your social life. What happens if you have to stop working? So your career changes, your roles change. All of these things need some tender, loving care. So this is all evidence-based. When we say emerging evidence, we're talking about what do the clinical trials say? Studies on these therapies with people with prostate cancer or loved ones of those with prostate cancer. What are the results? So every slide, every note that you see in my slides comes from a clinical trial. And if you're really nuts for the evidence, I can give you a reference list later. You can send me an email kind of thing. But mostly I didn't put all that information onto the slides, okay, because it's too cluttery and we can only look at so much. So another thing about integrative care is using the right health professional to give you information or to give you support. And it's not always about information, is it? Anybody felt inundated with information? Too much information. And how do you make sense of it? Yeah, how do you put it all together? It's not an easy thing. You know what? You're pioneers. You are changing the healthcare system. Now, a couple of other pieces about integrative oncology, and this is why my heart and soul is behind this big time, is it's a collaboration between you, your family, and your health professional team. Everybody needs to have a role. Everybody has a scope of practice, and you're the one who's the expert on your experience. It's all about you. So that's patient-centered care. And that's the kind of work I do provincially, traveling to the groups of health professionals and talking about, like, wait a second, are you listening when the patient or the person with the illness tells their story? Are you really paying attention to what they say is a priority for them? Or are you just kind of spilling out the information or the protocol that you learned in medical school or wherever? Okay, so it's all about you with respect for you as a decision maker. I mean, really, you've been making decisions your whole life, right? So it's not like you suddenly can't figure out what to do. I mean, you have ways, you have a process of making decisions. And I want to make sure people let you do it your way. It's your life, and you get to decide. And there's so much diversity. I mean, even in the room, I'm looking around. We have different ways of making decisions. We manage our money differently. We dress differently. So we're going to decide about our healthcare differently. It's perfectly understandable. And you're certainly one of a kind, always. I wonder if our health professionals forget that. Has anybody had that situation where you kind of get the feeling you're being treated maybe as a number, or just like the next gentleman? Yeah, it's not a good feeling. Okay, so we'll get those handouts. Did everybody almost get what? Oh, okay. So we'll just share, all right?
And with your permission, I can put them with your talk on the...
Yeah, let's do that. Okay, you know, if you didn't get a handout, we'll have that for you on the website. Karen will have that available. Does that take like a week, Karen, or a little bit of time? A day. What a master. Okay. So here's what I like to call the integrative medicine wheel. And you can see that on your handout too. And what I want you to do when you're thinking about your healing plan each day, you want to pull from all these different systems of medicine and aspects of healing. Okay, look at the top two on the right-hand side, surgery, pharmaceuticals. Okay, we're all over that here, Tom Baker. But wait a second, all the other herbal therapies, and you know most of the synthetic pharmaceuticals that are applied to illnesses, of course, originated with herbal medicine. So there's knowledge from traditional Chinese medicine is 5,000 years old. And our system of medicine, not so much, maybe 100, I'm stretching it when I say 100 years of knowledge. So special diets, ways of eating, lifestyle and behavior, huge. So how are you managing your stress? Do you get out in nature? Do you have people supporting you? Do you have people hugging you at the end of the day? So, you know, over here, this is the biggest area of study with cancer care, psychoneuroimmunology. So that is understanding how the way we think affects our physical tissue. Our cell membranes change based on the emotions that they're kind of floating in. So that's a little bit of what we call energy medicine, actually. So understanding that all our physical systems operate with electrochemical gradients across cell membranes. And when there's a change of like sodium and potassium moving across the cell membrane, changes the action on each side of the cell. And it also creates a magnetic field. So I know we have some engineers in the group, etc. Whenever you have an electrical change, you throw off a magnetic field. So, you know, I'm digesting my food now and I'm talking, I'm moving around a little bit. All the different systems of my body are contracting, moving, there's lots of action. So I'm creating a magnetic field. And so if I come close to you, we can feel each other's energy field, can't we? We really can. And so systems of healing come through that. Therapeutic touch, energy healing, Reiki, some spiritual healing, and not only that, our ECG, our EKG, our CAT scans, this is all based on energy medicine. What is happening electrically in the body. So, you know, there's lots of treatments that have energy medicine as their basis. So it's very interesting. Manipulative therapies, that's things like body work, massage, chiropractic, etc. So I like the idea of making sure you kind of pull all kinds of options into your healing plan, and you get to decide what you want to do and what feels good. So let's talk about them. I reviewed what's going to be safe to add on as adjunctive to your care here, what may be a little bit risky, and what's just going to help boost your well-being and really, you know, decrease your risk of things getting worse, or you know, you get other illnesses at the same time as cancer, or you even can get 2 different types of cancers. It's interesting, isn't it? Certain ways. So I use a site called PubMed. Who's used PubMed before? Lots of you, I know. Men with prostate cancer and their loved ones are so well informed compared to so many groups that I speak to. So PubMed is the place I go. I look for certain outcomes of the trials, what helps you feel better, manage your symptoms, manage your side effects, keep you calm. Anybody have trouble staying calm? Oh, nobody. Just me and Karen. Well, what about the traffic in Calgary? Doesn't that make you crazy? That's actually when I have the biggest trouble. I'm, you know, get a real problem, right? So I'm lucky that the traffic is the only thing that really bothers me too much. But of course, improving survival. That's what I'm looking for. So that's the site. If, Let's look at for those of you who have this sheet, I just want to tell you a few things about it. Speaking of websites, because there's some credible websites that I want you to look at when you want information about complementary therapies. And I didn't really explain complementary and alternative, but there's an acronym we use for that, CAM. So what I mean by that is therapies that are not normally taught in medical school, although they are more so being taught. And actually next door, we do have some programs now because we have a leading researcher next door, Dr. Maria Verhoff. Some of you have met her. So she's doing amazing work in medical education and how to evaluate complementary therapies. So therapies that you can add on to what is recommended for you here. Your doctor probably isn't teaching you how to meditate, but you can learn how to meditate in the courses next door. You probably know that already. But some other fabulous sites I want you to look at. Just know about Medline Plus. I don't know if has anybody used Medline Plus before. It's the National Library of Medicine. It's the best site to go for. First, for any type of information. You twist your ankle, go to Medline Plus. It has all kinds of great cancer information, heart disease, migraine. You know, it's really everything. It's the National Institutes of Health, National Library of Medicine, Medline Plus. So, you know what they have on that site is a list of all the tests that you may have to undergo. So if you need information about the tests that have been recommended for you. All natural health products are listed, and they're reviewed, you know, maintained currently, and there's information about any pharmaceutical drug you might have to take. It's just a fabulous site. Okay, so not just specifically for cancer. But if you go to NCCAM, this is the third one. This is the National Center for Complementary and Alternative Medicine. If you go to that site, you can sign up for a newsletter, and it is, again, the US, but it's all leading edge research on complementary therapies, so highly recommended. And then I've sent you to Memorial Sloan Kettering, MD Anderson, the traditional sites that you go to, the American Cancer Society, Duke Cancer Center, etc. Anybody have trouble figuring out what to eat? Who does? Yeah, I mean, it's kind of confusing, but there's a site here I want you to go to. Caring for Cancer is a colleague of mine, Suzanne Dixon. She has recipes that are absolutely delicious. Like if you're losing weight and you need to put on weight, you can check out her smoothies, etc. If you have a sore mouth or if you had radiation to the neck, etc. She has some really good tips for diet. So I wanted you to know about that. Okay? That's what's on the sheet. So that'll be on the website if you didn't get one. Now, why is it important? Like when Karen and Bob invited me, I was really honored. I've spoken with your group before, and I recognize some faces, in fact, which is really cool. But we need information about complementary therapies to be provided to groups with cancer because there is a lot of misinformation. I mean, it's a business, isn't it? Natural health products for sure. Even an unethical business, you could say, in some ways. So we really need some credible information because if you look at these stats, look at this survey, 4,100 people with cancer, and these are the amounts of therapies that they're practicing, spiritual practices, 60%, over 60% using prayer. Who uses prayer? I know. Almost 90% of people in the US will pray. This particular study, though, huge study with those of cancer, 61%. Relaxation therapies, fabulous. Supplements, meditation, etc. And I'll go over each of these. But if you look at the bottom, one of the least used is acupuncture. Who's tried acupuncture? Good. I'm so glad. And I hope you had good benefit. I'm going to have lots of time for questions in the end in sharing, so I would like to hear from you about acupuncture. But it is one of the most well-proven therapies and least utilized that it is state-of-the-art, actually, standard of care in a lot of the US hospitals, not so much in Canada. Like I know you have to go outside of the Tom Baker to get your acupuncture here in Calgary, but there's a lot of fabulous places to get it, and I'll tell you about the evidence. Incredibly strong. Probably 70% of you are using CAM therapies. That would be my guess. I spoke with Maria about this about a month ago. I wrote her and I said, what are the recent stats in Canada? This was what she thought. Mayo Clinic says, you know what? There's huge benefit, can be, let's say, and certainly significant benefit in the studies for acupuncture support groups. Here you are, amazing. Relaxation imagery of, massage, healing touch using music. We've done studies. They have been conducted on these therapies. So I'm going to tell you more. Now, this is really impactful, I thought, from Memorial Sloan Kettering. They said, look, these therapies are underutilized, and we want doctors, nurses, patients, families, everybody to know more about it. So I'm so glad you're in the room. Very, very glad you're in the room. Because you're leading edge. You really are. Most of these therapies focus on promoting health, so helping you sleep better. Who wishes you could sleep a little better? I know, it's a huge problem, isn't it? I want you all sleeping better. Okay, I got ideas for that. Honestly, it's so important. Do you realize how important your sleep patterns and the stages of sleep are to your immune function? Hugely important. Hugely important. Okay, most of these therapies are wellness focused instead of disease focused. So it's kind of nice. You get up in the day and it's not like going to chemotherapy. It's like, I'm going for a massage. So it's a different thing. It feels good. We want your energy going that way. Usually they're more comfortable. Mostly, not all the time. Who wants to guess how many complementary therapies there are? Over 50? Yeah? Over 100? Yeah? Over 150? Over 200 complementary therapies. And that includes all these natural health products that are coming on the market all the time. So we can't really generalize that CAM therapies are this, but mostly they are overall, and certainly the ones that I'm going to talk to you about, because I've just picked the top 21 that have strong evidence that that can benefit you. Let me just tell you quickly about the research. It's a baby steps field of research still, but it's growing very systematically, and I'm very impressed. Like when I started looking into this myself because of my own illness, this is about 10 years ago, I was astounded to see what the evidence was. And I thought, wow, I've got to tell people about this because it helped me. I didn't have cancer, but I was ill and I needed some help. So there they are. I'll go over each of these with you, and I'll put this list up again at the end. And you know what? Can I ask you, could you commit to just picking 2 or 3 things by the end of the hour that you're willing to do more of? You can see they're simple things. Let me tell you about the evidence. Who wants to hear more? Okay, good. Oh yes, I have to caution you. I mean, don't be abandoning your care that you get here. These are what are considered adjunctive therapies, so you add them on to what your oncology team has recommended, and you've had discussions with them, and then away you go. Speaking of your team, I hope you have had good experience with the healthcare system. We're always trying to improve, but it's a little stressful. And you know that a lot of health professionals have cancer. A lot of them are not feeling that well when they go to work. A lot of them are a little miserable too, and they don't want to give needles. Kara and I were talking about that, like the H1N1 training. Management, out of your desks, learn how to do the frontline work. So we're a little stressed, and it's really not fair. And so that's why you really are, in my opinion, the pioneers of the system. The feedback that we get from you is leading to, even me being hired with Alberta Health Services to come and talk to health professionals about, look, we're not listening well to our patients. We're not understanding their experience. And they're getting mad at us, and I don't blame you guys. You shouldn't have to tell your story over and over again to each professional that you meet, for example. Yeah. So just reminding you, though, you do have your responsibilities. You have to tell the truth about what's going on with yourself. Don't be stoic. Don't say the pain is okay if it's not okay. You have to tell the truth. That's your responsibility. Be really clear, and then be really clear about what you need. Say what's important to you. It's important to me to be out in nature. It's important that I have my dog with me. Whatever it is for you. That's what you need. That's how we have to figure out how to give it to you. Now, how to find a practitioner, I just want to let you know, mostly this is the fabulous way with your support group. Talk to other people, like, where did you have your acupuncture, and what was it like, what was the therapist like, what did it cost, etc. So talk to people. Talk to your insurance company too. Most are getting better because there is cost evidence benefit for these therapies. and the insurance companies are pleased to cover some of them. Now, how to assess information. I'm going to skip this because I've done this for you for the top therapies. There are some red flags. If you go to a therapist and they're not willing to work with your oncology team, I would walk out the door and find someone else. Because you are looking for, as I said, that integrative. You want your oncology team on board with your complementary therapy persons as well. Okay, you know what? Don't ever forget this. Ever. So you have a tumor, you may have a blood illness. There's always more wellness than disease within you. So what if you focused on the parts of you that are well? Do you ever think maybe you focus too much on the parts of you that are not so well? I wonder if that could be true. So this is a way of thinking that lifts your energy, it lifts your commitment to choose healthy lifestyle practices, for example, and it really makes sense. And you know who I learned this from? Is one of your leading urologists. I'll go to his slide. Here he is. Mark Moyad. You know his work maybe. He says, no dietary supplement has come close to matching the reduction of all-cause mortality observed in clinical trials of lifestyle changes. So I had to quote it. That's how he said it. I know it's hard. What he means is, focus on healthy lifestyle. Don't worry about things that we're not really sure work very well yet. Because I don't know, have you ever been on the computer? Oh my God, I want to try this natural health product. Oh, if I buy it in the US, it costs a little bit less. Oh my God, then I have shipping, and I wonder which dose. Do you ever do that on the computer? Who does it? Yeah. He says, don't do that. Go for a walk, hug a tree, you know, focus on what we already know. Don't worry about this obscure product that maybe will help you, maybe not. It's just too anxiety provoking to really worry about those little things. Let's go with what we know. We know tons already about what's best for you to do. I just want to remind you, here's what he says as well. Anything you put into your body, you know this, can profoundly affect your health. And we forget every single thing. And not only that, every thought that we have about ourselves profoundly affects our physical health too. Don't forget. It's all about immune function. Now, if we focus on healthy emotions, calmness, trust, I mean, I'm not saying this is easy. I know that. It's not. It's very difficult at times. But if we do what it takes to remain peaceful, that is what we call the healing state. When we're in a relaxed state, okay, blood pressure is low, heart rate's low, respiratory rate is low, that is where our white blood cells work best. Our immune function needs that state to do its work. Your body knows how to get better. Your body is working to heal all the time. You have an amazing body. Amazing. If you just honor that within yourselves right now, say, oh, wow, you know, I'm sick. Parts of me are doing pretty good, right? Okay. Physical activity. This goes without saying, although I have had trouble saying it, but make sure you have an exercise program that suits you. It doesn't have to be fancy. It doesn't. A couple of ankle rolls right now, do the trick. Very easy. A little bit. Now we know that a lean body weight, there's a lot to be said for that. It really helps in accuracy of diagnosis and helps with the effectiveness of treatments, etc. There's so many things it does. Physical activity keeps you leaner, and it also helps you sleep better. Have you ever noticed that? Yeah, for a lot of people it does. It helps decrease anxiety and depression and many other risk factors for other illnesses as well. Y'all know that, cardiovascular health, etc. So again, we're starting into the statements. These are each pulled from a clinical trial, and if you want to know more, just let me know. Here's a little bit of information about Tai Chi. Who's done Tai Chi before? Yeah, did you like it? Yeah, what did you like about it?
It's very relaxing and it's easy.
It's easy and it's relaxing. Okay, you know what? Put your feet flat on the floor. We're going to try something. Just put your papers on your lap for a sec. Don't worry, we're not going to get up. But we are going to do some Tai Chi. Hands like this. I just want you to lift up and press down. And lifting up. Oh, you look beautiful. And down. One more. Pressing down. That's a Tai Chi warm-up. I want to ask you, did you notice anything happening with your breathing when you did that motion? Slowed, didn't it? Your breathing slowed right away. You're pulling yourself into that therapeutic healing state right away with just 3 simple movements. You didn't even have to sweat or anything. Okay, like you say, simple. So that's what Tai Chi is. Very, very easy. Look at these studies. Medical science, sports and sports and science. Look, this is a cancer group, breast cancer group. Look at this. Functional capacity, aerobic capacity, strength, flexibility. So when I say functional capacity, that's your ability to get through the whole day, get everything done, get the laundry, walk the dog, go to work, give your wife a kiss, whatever you need to do all day long, not run out of energy all day long. That's functional capacity. Who wants more of that? I know, I want what we all do. More of that. Helps your bones stay strong. If you're on hormone therapy, okay, you guys, you want to keep those bones strong. Helps you sleep. Radiation fatigue decreased. Self-esteem, breathing, all that good stuff. So Tai Chi is very easily available at the Taoist Tai Chi Society. They're on Crochow Trail, and there's courses all over the city, actually. Very cheap. I think it's $40 a month. Okay, who does yoga? Do you have some yoga? Oh, yay. Now, what's good about yoga? Anybody want to tell me? Gentlemen? It's relaxing. And you know what? Yeah, it's not, you're saying, why isn't Chris giving us the science? Well, you know what? I am giving us the science. It's relaxation is what you need. Simple. Whatever keeps you calm. And, we get to that place in different ways. I love Tai Chi and yoga. Fabulous. Helps with lymphoma, decreases blood pressure, all kinds of good stuff. So here's the summary of what physical movement can do for you. Mainly, big one, down here, I don't know if you can see. Survival, it's kind of big. Oh, constipation, anybody, you don't need to say. But however, maybe could use some of that help. Don't forget your water. Who's got their water? Who's got their water? Oh, where's the water for everybody else? Anyway, there's water out there, isn't there, Karen? And there's fluids and there's juice. Good. You know what? You need lots of water. If you're taking any medication, you especially need lots of water. So if you could resolve to just have a little bit more of that, that alone will help your physical functioning, okay? I really want you to do that. Simple. Okay, here's the studies on acupuncture. If you have had any fatigue due to radiation, this is a radiation trial. Imagine to decrease your fatigue by 1/3 almost. Would that make a difference in your day? It would. It would. Helps, you can use less meds for pain relief, mental clarity. Anybody get that foggy kind of brain thing happening? Who has that sometimes? I know, the rest of you are not telling the truth. It happens, doesn't it? Hot flashes, no need to disclose. Now, mixed studies actually. Most studies show benefit for some. But you know how if you have a study of 100 men and 50 benefit, let's say 49 benefit but 51 don't, the conclusion of the study would be there's no benefit from using acupuncture for hot flashes. But don't forget, those 49 men did benefit. So, a review of studies, it's still not real clear, is this kind of the way to go for hot flushing, but it really helps certain men. I don't know if you've had xerostomia, like that dry mouth, that tender mouth. Acupuncture can help with that. And I've let my dentist friends know about that too, to really maintain the health, the energy through the throat, etc. If you've had radiation around the throat area. Different types of cancer. Now, acupressure to manage nausea. Now, this is a breast cancer study, so that doesn't apply to you, but I also saw one recently with prostate cancer. Now, if you ever have any nausea, and not just related to chemo, but air, flying, car sickness, pregnancy doesn't apply so much in this group, I don't think. But have you ever been on a cruise? Ever noticed people wearing those wristbands? Why do you think they do that? seasickness, and they press against an acupressure point called P6, the inner gate. So I want to show you where it is. Take your 2 fingers, and you see your wrist crease. Just put your 2 fingers under the wrist crease. That's about how low you go, and in between the 2 tendons in the wrist. This is your P6 acupressure point. And just applying a little bit of pressure there can decrease nausea. And that's why those little C-bands work. So if you're undergoing chemo, just do a little bit of this while you're in the chair. Lots of studies have shown that it's beneficial. Easy, easy. Now, you know what? You need lots of touching. And I hope you're getting lots of touching. If you're not, you need to find a way. Teddy bear, pet, somebody to hug, all right? It's really underutilized in healing. We know this from pediatrics. We know this from palliative care. So find a way to maybe have a massage or some bodywork therapies. That'll help you sleep as well, and that constipation issue. Aromatherapy is just a special kind of massage therapy if you like aromas. And I know you gentlemen, you like these tender little things. Now, this is a study of 1,300 patients. They didn't all have cancer. There's lots of illnesses in this study. But anxiety, stress, nausea, just general symptoms decreased by 50%. So, you know, that's a pretty easy thing to do to help with symptom management. So I want you to think about your own symptoms right now. I don't know, headache, back pain, up, middle of the night, 3, 4, whatever it is for you. If you could decrease that symptom by half, would it make a difference? Okay, very easy. Massage. Oh, I wonder if we have some meditators in the group. Do we have anyone who meditates? Yeah, gentleman in the jean jacket. What is it like for you? What do you find some benefit? Obviously.
A great deal.
What does it do for you?
I guess for me, it allowed my body to heal itself.
Wow. You kind of got out of your own way mentally, maybe? Is that maybe?
Well, it just sort of slowed everything down and gave myself, I was so conditioned to always looking outside of myself.
Yes. Yes. Yeah. Yeah.
This opportunity to look inside.
Mm-hmm. Thank you for sharing that. Yes, that's meditation, for those of you who haven't tried it, very easy to learn, very simple to learn, actually. And it's a way of really, as you're saying, shutting off all the outside distractions, like really closing down your 5 main senses, going within. What's going on with you inside, at your core, at your spiritual level, and really knowing yourself there, and just allowing. Your body has its own intelligence and can heal. There's a book about meditation I want to recommend to you. I don't know if any of you have used Full Catastrophe Living. Are you familiar with the book? I see a few heads nodding. Full Catastrophe Living. And it's John Kabat-Zinn. And you know what, I'll just let you know, I do have my card at the back of the room. If you don't, if you've missed a few things and just want to ask me a quick question, like what was the name of that author, just send me an email. But John Kabat-Zinn, and it's an old book, it's 1990 actually, but it's the best book I've seen to help learn to meditate, help with relaxation therapies, help with mindfulness, and it's just fabulous. So I want you to know about that. Did you know if you do a brain scan, when someone is meditating compared to when they're not meditating, or a meditator compared to a non-meditator, you see completely different activity in the brain. It changes our brain function. It's amazing. Very easy. Well, simple techniques. And you know, you can meditate in many different ways as well. So I encourage you to give that a try. Now, guided imagery. This is where, again, you create an image in your mind of a situation. And you know what? Your body can be fooled. Okay, let's try it. I want you to close your eyes. Close your eyes, okay? And you're going to bring to mind your favorite place. Could be a place in nature, could be a place in your home. Okay, so settle in your favorite nature place or your favorite home, room or chair in your home, and I want you to notice, what do you smell around you? So I, for example, I'll stop talking in a moment so that you can have your image, but I like to be in Bermuda, so I can kind of feel the sand in my toes, I can hear the birds, I can kind of smell some flowers and the aromas, can hear the ocean, etc. So what do you see, hear, feel, etc.? And I'm going to stop for a moment and just be in your nature place, okay? When you're ready, if you'd open your eyes. So again, what happened? Did you notice anything happen in the body? Yeah, the breathing changed. As soon as your breathing changes, your breathing relaxes a little, your respiratory rate goes down, your pulse is calming itself. That means you have an improved blood pressure, lowered blood pressure. All this means improved immune function. Simple, simple. Okay? So you know what, when you're in your nature place, you're doing like a guided imagery. There's lots of audio tapes at the library, for example, you can use, or you can just create a visualization for yourself. Your body doesn't know that you're not in Bermuda. My body didn't know that. I could actually feel the sand in my toes. You can trick your body. So the more you kind of get into that state, and just forget you have cancer for a couple of minutes, or just forget you're kind of older and you want to be younger, whatever you want to be, wherever you want to be, you can be that in your visualizations. And they change your physical tissue. Athletes have been using this forever. It's a trick you can use for any kind of intention that you want to set or anything you want to achieve. It does change your white blood cells. Yeah. Blood tests taken before and after maybe a 6 weeks course, maybe you're listening to a visualization tape for 3 or 4 times a week for 20 minutes. You do your blood immune markers after, there's changes in your white blood cells. Try it. Hypnosis is another one, works very similarly. We get into such a relaxed state with hypnosis that we become more susceptible to ideas of health changes or behavior changes or whatever it is that you need to change. Okay? So helpful for breast cancer, helps with fatigue. Kids love it. Kids love hypnosis. They think it's a game, and it is a game. Anything that will help you relax. All right, now this slide actually, these are types of relaxation exercises that you can get in the book that I mentioned, The Full Catastrophe Living. All right, you can try a body scan, and that can help you get to sleep. These are easy ways to get to sleep. Who loves music? Yeah. Of course, you have to play the music that you love. I'm just like rap music, for example. Who loves rap music? Oh, yeah, good. All right. We should get some performing. Now, here's what the studies show. And I have to tell you about a new one that I just read. This is too funny. MD Anderson helps with stress, pain, discomfort, etc., reduces anxiety. And the one that I just read, I forget where it was conducted, there was good effects. They looked at the effect of having music playing on the health professional, and just that it did help. People loved it, people enjoyed it, but the one downside of the study, people weren't moving as fast. They weren't getting as much done. So I thought that was kind of cool. The art of slow. It's not a bad thing. Expressive writing, I have to tell you, this is just journaling, and this is my area. This is, believe it or not, my field of study at the PhD level. There are clinical trials with different populations just to look at what does writing do for us and how does it help us? And yes, it does. These are interesting cancer studies. It does help with pain. Decreased medical visits. This was a prostate cancer group, men with prostate cancer, just not needing their health team as much, which is kind of nice to stay out of this building for a while, hey? That'd be all right. Helps with body image. Now this last group, yes, these were renal carcinoma in hospital. So ever tried to sleep in a hospital? Yeah, not easy, hey? Yeah, so a little bit of writing before bed helped people sleep better. So what's the theory behind that? I want to just ask you right now to don't think of a pink elephant. I don't want anybody thinking of pink elephants, okay? Please don't do that. Don't do it. So what happens when you try not to think of something like, oh, I'll just forget I have cancer. But in the middle of the night, what happens? You wake up, oh my God, right? So that's what we call intrusive thinking. The more you try to suppress these intrusive thoughts, the more room they take up in your brain. And this is really a simple way to explain what we call a working memory. If you do a little bit of writing before you go to bed about anything that's distressing you, or even things that you're just loving, positive benefit writing. Do a little bit of writing about your emotions. You will sleep better because your emotions are not kind of churning as much around while you're, during the night. You're going to sleep more soundly. Very clearly seen in the studies. And you wouldn't believe what the studies show with other populations too. Kids in university getting better marks. People who've lost their child, which is so, dramatic and painful, doing better, doing a little bit of writing about it, even writing, as I said, about the positive benefits of having cancer. Okay? So anything that, we just become more aware of what's happening within us. It's like having a friend, your paper doesn't criticize you or write back. It's just completely accepting of whatever you say. And, actually you could even do your writing on a computer, and if it's really, not so pretty, don't worry about punctuation or swearing or anything. Just delete it, okay? So just get it out of your body, how you're feeling. Very easy. Now, I'm sure lots of you are very creative in either creating music or art, and maybe you loved crayons when you were a kid. Anyway, you should bring that into your life if you can. Studies show that it's very therapeutic. It helps you communicate about how you're feeling. And it's a way of expressing yourself and releasing tension in the body. All right? And it's such a beautiful thing to leave behind. This is some artwork from Hospice Calgary. Fabulous. And it doesn't need to be fabulous. It's just a way of expressing. Now, you've heard about the studies about support groups, and you know the benefits of it, because here you are with one of the most amazing groups in Calgary. People supporting each other. It's a beautiful thing. Do you know one thing that support groups do? This is what the studies say, so I'd be interested in your own experience. It helps you explore your beliefs about healthcare. And your beliefs about anything can get in the way of your healing. So let's say you believe the healthcare system is a big disaster. Don't let me know if you feel that. I don't need to know that. But that belief is not going to help you get better. So one way of saying is, well, I have a sense that this aspect of healthcare is not so wonderful, but however, I met this fabulous, this nurse who was working with me. She's amazing. So just defocus on what's not working so well, focus on what's working better. Because when I was a kid, I learned that it wasn't okay to be sick. And I remember in my family, there was 4 of us, we're all same age, and if we got sick, Mom would give us a glass of ginger ale. She'd say, go to your room and come out when you get better. And so I kind of learned it's not okay to be sick. I don't want to be sick. So when I got sick, it was really hard for me to be okay with myself. And that's something I had to learn. I mean, fabulous people get sick. Look at us, hey? So a little bit of writing about that is good as an adult, but just knowing what your beliefs are, talking about them, being aware of them, what's helping you get better, what's in the way of you getting better, okay? And really helps, of course, as couples, all these fabulous things that support groups do. And there's a number if you need the Tom Baker Psychosocial Support Service. Who's in love with their pet? Anybody? I bet you we have amazing pets. Pets are healing. Pets are healing. I mean, look at this. Look at this, hey? The elderly live longer when they have a pet. This was women going in for breast biopsy. Those who were instructed watch the fish swim, they had lower pressure, did better, less pain with their biopsy. And I have to tell you, I have this study. Oh, wait till you hear about this. Woo! Cardiac patients, now, so not a cancer study, but these were men, who had been in hospital for bypass surgery or what else? Angioplasty, etc. So cardiac surgeries of different kinds. Then they were released, and half of them were given a PET. Of course, they agreed to take a PET. And then they were looked at their recurrence rate of their closure of the angioplasty, for example, or things going wrong in the next year. And so the people with PETs did much better than the other group. But there was another group. The people with pets did much better than people with spouses. It's true. I just cracked up when I read that study. It's true. So we know what pets do for us. They're just accepting, aren't they? They love us no matter what. Bad breath, they don't care. Cancer, who care? They don't care. They love us. So use your pets. Prayer and spirituality. I had the honor of being hired a couple of years ago with the Health Region to do an educational program in chronic disease management about spirituality. So I was educating frontline workers to increase their confidence, really their skills to talk about spiritual health and what is the evidence base. And there is an evidence base, meaning the trials show if you have a spiritual practice, and that's individual to you, whatever it is for you, those people have what we call a more active coping style. They're just kind of making calmer decisions and better decisions and just promoting health better. And so spiritual practice is something that can really just help you feel better every day, improve your quality of life. So like I say, prayer is one of the spiritual practices that is in the clinical trials that seems to have a very positive benefit. And it's interesting, one study I saw, actual blood markers again of immune function improved in people who pray compared to those who don't. And even inflammation. This is a rheumatoid arthritis study. Amazing. Yeah. So think about that. Very easy. Energy healing, I think I mentioned earlier, these are things like Reiki, therapeutic touch. Another type is called esoteric healing. Healing on the subtle energy body, on the magnetic field that we talked about. Fabulous kinds of symptom management. And in the U.S. hospitals, it's actually pretty much standard of care to have energy healing. Sometimes even in the surgical suites, they have people holding acupoints at the bottom of the feet, etc. So those are the kinds of things it can do for you. Very beautiful therapy to undergo is to have a Reiki treatment, for example. And you see, these are the chakras of the body. This comes from Ayurvedic medicine, Indian medicine. And these are kind of the energy plexuses of the body where there's a large amount of nerve activity, and it does create a different kind of magnetic field. And then working on those different areas of the chakras of the body seems to have a therapeutic effect. So I don't know if you've tried energy healing. Very gentle. Has anyone tried Reiki? Yeah, a few of you have. Yeah. Okay, now is this what you're like in the health food store? I know I am, and I mean, I do this for a living and I study these products and I can feel for you. It's a jungle out there, isn't it? And you're not always getting the best salesperson, is what I've noticed. Now, oncologists and your team members, they do have valid concerns about natural health products, and these are some of what they are. But this is just kind of the dark side. There's a lot of amazing products available too, so I'm going to tell you about a few of them. Now, there has been some liver and kidney damage with misuse of products, so there's where some of the caution comes from. Some of the labeling is not as clear as it should be, and there's been contaminants and fillers put into different products, etc., hormone fillers. And adverse effects are not always, on file somewhere so you know what you're dealing with. So those are the concerns. But however, Health Canada has, he keeps saying new, it's not new, but the Natural Health Products Directorate is a body, government body, where the Canadian products on the market now, manufactured in Canada, have to have a certain labeling standard. And the facilities are quality controlled with certain regulations in order to create that label on that product. And there's a number you call if you have to report safety issues, adverse effects issues, etc. So my recommendation is buy a Canadian product because it's been evaluated. Okay, so you're looking for a drug information number, natural health product number, or a drug information number homeopathy, so a homeopathic product, okay? So that's my recommendation, just to make it easier for you when you go into the natural health food store. Say, who's the credible Canadian manufacturers? I want to know everything that I need to know on this label. because some things in those products may interfere with the medications that you're taking. Very common. So here's one, St. John's wort. Let me tell you about this one. St. John's wort is for mild and moderate depression, and it's very effective for depression. And that's what the clinical trials show. But what the problem with it is it is a very strong medication or natural health product, and it interferes with many, many other meds that you may be taking. And I want to tell you what they are, and then I'm going to test you, okay? St. John's wort well, what it does, it changes how the system, the liver cytochrome system affects the metabolism of the drug, of the pharmaceuticals that you take, okay? So it's going to change the blood levels, maybe different than what your physician was really expecting. So it interferes with Taxol, commonly used for cancer. Cyclosporine, that's an antibiotic. We have digoxin, calcium channel blockers, so heart meds. Birth control pills, careful, because it changes the blood levels. Zocor for lowering cholesterol, theophylline, that's for asthma, warfarin, some HIV drugs, Imitrex for headache, on and on and on. It interferes with other natural health products. It interferes kind of with some foods. So if you're taking St. John's wort, it has less adverse effects than many of the antidepressants that are on the market. So if you're taking it, and you may be, don't do it without telling your physician, because your physician will adjust the levels of your other medications, especially your antidepressant, okay? So it's an excellent product, and it is actually used as a photosensitizer in radiation, because you know another side effect that it has, it sensitizes our skin to the sun. So, you know, you'll need a hat, you'll need a sunscreen when you're taking St. John's wort, and for that reason it's used together with radiation to increase the effect of the radiation. So it's a very interesting product. Now I wanted to let you know about glutamine. This is an amino acid that's found naturally in the body, but studies have shown that a glutamine powder can actually over the long term decrease neuropathy, or it's kind of the painful nerve feelings that you have long term, maybe after some of the treatment that you may have had, okay? It can help with mucositis, help with diarrhea. So I just wanted to mention that to you. Now just also remembering that if you're going to take a natural health product of any kind, to make sure you talk with your team about it. You really have to do that, like I say, because it may be interaction with some other treatments or products or pharmaceuticals that you're taking. Now, antioxidant foods, this is always sometimes a mystery when we're in the middle of treatment for cancer, but the antioxidant foods themselves, we want lots of them and often, right? So any of these beautiful colored foods, because we need all these vitamins and minerals, vitamin A, C, E, beta-carotene, selenium, especially for you gentlemen. And you've heard antioxidants, what they do for the body. They keep the cell membrane strong, all right? So the question is around the supplementation. Now, what most oncologists feel, although it's a matter of debate, if we had 20 oncologists on this side of the room and 20 on this side of the room, there would be loudness, there would be words about who kind of has the best view or who has the strongest view about taking supplements during treatment itself, so during your course of chemotherapy or your course of radiation. So most will recommend you stop for a couple weeks before and a couple weeks after. Why? Because the supplementation, theoretically, it may be strengthening the cell membranes that we're trying to break down with the therapy, okay? So that's the theory behind it. So it may be of questionable benefit. And so if you have questions about this, make sure you talk to your team or call the dietitians here and talk to them about it, because you're such an individual, your case, you need to discuss these things one-on-one. There's no blanket statement that fits. Can maybe depend on what meds you're taking, what type of cancer you have, what stage of cancer you have, etc. So a lot of things to be considered because you're so unique. Let medicine be thy food and food be thy medicine. Here's some great foods that you need. Not exactly a complementary therapy, but I just want you to know about this. Any kind of allium vegetables. Who loves garlic? Oh, love it. Do you love 4 grams a day? Hopefully all your family loves garlic as much as you do. So garlic's fabulous. Look at the things it does for you. It decreases many types of the risk of these cancers. And of course, we know its benefit to cardiovascular health, mental clarity, etc., the circulatory system, etc. Okay, so lots of garlic. Lycopene, of course, you gentlemen are aware of this, significantly can reduce risk of prostate cancer or recurrence of prostate cancer as well, even pancreatic cancer. So this is a well-designed study in a credible journal that I found. So 6 milligrams a day, okay, just a little bit of spaghetti sauce, etc., with your garlic, right? Now ginger, was I the only one who got ginger ale when I was sick when I was a kid? Who got ginger ale? Yeah, it works. It works. We know this about ginger. And the studies are stronger and stronger. So it does prevent nausea, 2 to 4 grams a day. So, you know, I like to take the ginger root and you actually just scrape it into a tea or into your spaghetti sauce with your garlic, right? Mushrooms. Who loves mushrooms? Oh, good for you, because they are good for you. I'm allergic to mushrooms, so I can't even really look at my slides. But I just learned, there's another study I read recently, the little button mushrooms are good too. So it used to, we didn't really know what type of mushrooms is specifically excellent for you. And, you know, it's still, the jury's out on that. I mean, people just say, have as much mushrooms as you like. We know this from Asian medicine, that mushrooms are known to boost immune health. So if you enjoy mushrooms, have lots. They do these different things. They're said to be really helpful with certain cancers, the hormone-related cancers, because they decrease and inhibit aromatase, which is an enzyme that can exacerbate cancers, hormonal cancers. Okay, so if you love mushrooms, have lots. Oh, do you have this in your cabinet, your kitchen cabinet, cumin? Okay, good. Yeah, again, knowledge coming from the East, coming from Eastern medicine, Asian, India, lower rates of colorectal cancer, so different types of cancers. It seems to really be helpful. Even breast cancer. So I didn't come across a prostate cancer study, so I'm not sure about that. But turmeric, up to 4 grams a day. All right? What's that?
It's recommended.
Good, good.
By the leading oncologist in the States.
From MD Anderson?
No, his name is Dr. Snuffy Myers.
Oh, good. Well, thanks for sharing that. So did everybody hear that? Highly recommended Dr. Snuffy? Snuffy?
Yeah.
Snuffy? Snuffy Myers, yeah. Leading oncologist in the US. And I'm happy to hear that because I looked at MD Anderson, their comments on turmeric, which I don't think they're really as updated as they should be, although they do update every 6 months. And they're saying, well, we're not sure about turmeric, but every study that I've read, like individual clinical trials, yes. So as much as you can tolerate, if you like having yellow food, don't put it on your cereal maybe, but lots of turmeric. Okay, you're drinking your green tea, I'm sure, hey? Yeah, good. So green tea, known for quite a while. The studies, again, stronger. Used to be kind of 50% said beneficial and no harm, but not necessarily a benefit. But it's certainly building up. Strongest evidence for green tea is to decrease prostate cancer risk. So you guys are, I'm sure, all over that. And it does help with salivary health, too. So all aspects of the gastrointestinal tract, okay? So the GI cancers. Lots of green tea, lots, as much as you can enjoy. All right, now you want to make sure you're having enough fun. Who wants more fun? Okay, you know what? That's your job tomorrow, is to have more fun, or even tonight. And it's extremely important. I say that joking, and that's what we need to do, is joke more. You know the work of Bernie Siegel? Some of you love Medicine Miracles? Yeah, so he's a cardiac surgeon, but what he recommends is when his patients are in hospital that, you know, they have their prescription for certain medications, etc. And they also have prescription 30 minutes a day of the Comedy Channel. They need to watch the Comedy Channel. So whatever is funny for you, so some of it Some of you could be jokes or a certain person or a pet or watching The Office on TV or whatever it is for you. You need to put that in your plan every day. Make sure you get that every day. It changes your immune function. It's another one of those things. You can't really be tense and laugh at the same time. You can't do it. You can't do it. So there are a few, even some sites on the web I noticed. I searched tumor humor. And so there's a few, I didn't bring any jokes with me, except the best thing that I ever heard, doesn't apply to your group, but it was a colon cancer support group, and they call themselves the semicolons because they have surgery. I love that. I thought that was so sweet. But you need more fun. Think about what you used to love to do when you were 7 years old. Who wants to share? What did you like? Who? Call it out. What did you love to do? Well, climb trees. So Karen, are you still climbing trees? But you should do. Give it a try, like a bush. Okay, you don't have to go. Yeah. No, the things that we loved, you know, really, like I used to love jigsaw puzzles when I was a little kid. And I know my brother loved to do those models, like airplanes or trucks, fire trucks or whatever. That's what we used to. We used to fight a lot, and so we would fight, and he'd come and he'd rip up my jigsaw puzzles, and I'd go and I'd rip up his models. So it wasn't good. My brother and I still don't get along as well as we should. But whatever game it is that you love to do, think about doing more of that. If you loved artwork, if you loved creating things, if you love singing or making music, or if you love dance or climbing trees, like I just last week in one of my classes, a woman, she was a psychologist. She said she still climbs trees. She does. And she's really tall. Like she's about 6 feet tall. It's just so cool. I thought, how does she find? I don't even know how to find a good tree anymore. Like I forget. Oh, see, she knows where the good trees are. All right. So listen, based on evidence, there's the 23 options that may help you. So I would like you to choose a few. What are you going to do more of? Who wants to let me know? Just so I feel like I've accomplished something today. Yes?
Want to try meditation?
Oh, are you fabulous, the gentleman in the white?
What did you say?
Meditation, he's going to give it a try. Or you do more of it, or start?
Yeah, I'm going to stop.
You're gonna love it. I think you really will. Now, who? Yes, gentlemen, our meditator.
The psycho-social department here at the hospital.
Yes,
They offer courses.
They do. They do. Yeah, if you
get in touch with them, we can go through.
Yeah, that's right. So if you want to go on the website, the slide that I put up with the support groups, dial that number. They have ongoing 8-week meditation class, and sometimes you get involved in a clinical trial at the same time. A little bit of yoga with the meditate. Is that how you learned how to meditate? You did the course? Yeah, it's fabulous. It's Linda Carlson's work. And if you want to look at her research, did you meet Linda? Yeah, so just fabulous work, very well known globally for her work on meditation. Meditation changes what we call the endocrine axis, the ways that we produce different hormones in the body, and the hormones have huge effect on the body and certainly in our healing response as well. So meditation, that's so wonderful to hear. Who's going to try expressive writing? Who wants to do a little bit more journaling? Good, good. I'm happy to see. Very easy. Very quick. You can feel better in a matter of moments when you're doing your writing. Doesn't have to be fancy. You could throw it out or keep it. It's very interesting to read. Who's willing to try a little more humor? Magic mushrooms. I love, there's always great ideas coming forward. Whose idea was that? Okay, yeah. Oh, everybody's blaming. That was him. Yeah, magic mushrooms. I think button mushrooms, shiitake mushrooms, okay. All right. Who's going to try a massage? Oh, good. I'm so glad. Yeah. You know what? I'd like to see more people open to massage. You don't have to pay a therapist. There's fabulous therapists, well-trained, but if you can get someone else to give you a little shoulder massage, etc., or a little massage before you go to sleep, your loved partner, okay? Ginger green tea, hypnosis, art therapy. Look, these are so simple. They're so easy. This is science. This is clinical evidence. It's strong. It's indisputable. We're a little slow in Canada getting these services into our cancer centers, but you're the leading edge here. Like you say, we have yoga and meditation right here in different support groups. We have writing. We have a little bit of dance, the creative arts therapies. Oh, that reminds me. I want to tell you where you can sample these therapies at Wellspring. Who's been to Wellspring? Good. Okay, what did you try at Wellspring?
Exercise.
Exercise class? Yeah? Were you doing like a labyrinth or something?
I was in labyrinth room. They haven't seen a labyrinth in the new building.
I don't know. I think maybe they're going to plan it for outside. I was at the opening. I don't know. Isn't that a fabulous new location, hey? But Wellspring, for those of you who don't know about it, go on to the website, Wellspring Calgary. You can try, for example, meditation. You can do some journaling. You can do some art therapy. They have everything except acupuncture. I called and I said to Trudy, look, Patty, I said, why can't you offer acupuncture? And the reason is it's more of a technical service, and they just don't have the facility really for that. But that's the only thing that you can't get at Wellspring. You meet fabulous people, music, prayer, Tai Chi. They have Tai Chi at Wellspring, okay? Oh, a specific group for for you guys. Oh, la-di-da. How's that?
Drumming.
Drumming, yes. That's Kim Polvey. Have you met Kim? Yeah, she's a colleague of mine. Fabulous. Okay, so I just want to let you know about Wellspring, and I have time to receive your questions or sharing. Do you want to share something that has really worked for you that you want the other group members to know about? Yes, gentlemen.
I hear so many different stories about how much water today
Oh, yeah.
can be substituted for your soda pop or
No.
my friend here said beer or whatever. Does it have to be straight water?
Well, you know, yes and no. Yeah, so truth is, you know, beer is all fluid. Soda pop is as well. But really you should have pure water if you can. And maybe cut back on the beer. Or
They talk about 6 or 8 glasses.
yes, 6 or 8 glasses.
Might be in the bathroom all day.
Yeah, I know. And that's why I know. That's why I actually had that on the slide, I think up to 3 liters a day, and I took it off. So I know it's a bit of a challenge, but you should drink as much water as you can and be sensitive to be aware of when your body is wanting water. But everybody should have water with you. You really should have water with you all the time and just sip it slowly. Like you don't have to drink a lot of it.
We have to take 3 liters a day, don't we?
It is. It depends on you, your height, your fitness levels. It depends on 3 liters is too much, so that's why I pulled it off. But athletes drink 3 liters easily, and you don't want to have to add salt. So just drink a comfortable level of water. Don't worry about the volume, but always have it with you, really, because probably right now a lot of you, who's feeling thirsty, feeling a bit, yeah, a lot of it. So you know what? You shouldn't ever feel thirsty. There you go. Yes, who can offer water? Gatorade? Was that your question?
Yes.
Yeah. Well, you know what? I'm actually not a good person. I'm not a fan of Gatorade. I'm really not. But I've had endless disputes with people about the electrolyte waters, and being a exercise physiologist, we talked about this. Gatorade might be appropriate for you. Depends on your energy level and your leanness and how much you sweat.
I skied a lot, I played a lot of tennis, and if I don't get the minerals back in,
Yeah.
then I get cramps.
Good. Okay, so you are, gentlemen, you are expending a high amount of energy, so you do need to replenish your electrolytes. Yeah. So you know that. Your body's told you that, eh? And good for playing tennis. That's my best sport too. What's that? Good. Yes, sir.
I was wondering if you could give us the address of Wellspring.
Yes. Let me do that. Just down the hill, actually. I wonder if they have their new ad. They're on Home Road, 1401, thanks Karen, Home Road. And they've just moved to a new building, privately funded. You should see this building, hey? It's absolutely beautiful. All kinds of different rooms, meditation rooms, they have a little kitchen, etc. So 1401 Home Road. So if you go onto the website, they have their calendar, and you can see which classes you can drop into. Some you have to call and let them know that you're coming.
What's the name of the
Wellspring.
Wellspring?
Yeah. Wellspring. Wellspring. More questions? More comments? Yes, sir. Okay, good question. So explain the difference between naturopathy and homeopathy. Two very, very different systems of medicine, but they overlap a little bit. So naturopathy is really, that's a great question. Thanks for mentioning that. Probably a naturopath is going to address many of these aspects of your daily healing plan. So a naturopath will talk to you about your diet, talk to you about your stress level, talk to you about your diagnoses, talk to you about your mental health, your emotional health, etc. They may be recommending certain natural health products for you, certain exercise programs, certain evaluations about your emotional health as well. So naturopathy is not a specific therapy. It's a holistic view of forming a healing plan. So it probably pulls together quite a few of these things together with conventional care. Now homeopathy, and I have to tell you, let me just think for a minute. I'll explain that in a sec. There was a study I read this morning. I think it was a homeopathic saw palmetto product, and for prostate cancer, I'm trying to remember, you know what? I don't think I'm going to be able to remember. But let me tell you about homeopathy. So this is an energy medicine technique where a homeopathic physician is very highly trained. Both a naturopath and a homeopath have at least 4 years of training and usually a degree before that. So as much training as your physician, and they are a naturopathic physician and a homeopathic. So one will be a HD, one will be an ND. And a homeopathic physician will spend probably 2.5 hours with you talking about your character and your constitution and who you are in terms of your behavioral patterns, how you live your life, what kind of they'll even look at your Ayurvedic doshas, like are you a really active person, are you a more lethargic person, etc. How do you cope with stress? Very in-depth evaluation of who you are. And then they will prepare homeopathic remedies for you, which are highly diluted compounds of plant roots, barks, leaves, flowers, etc. And even some different metals as well. And it's the energetic signature, really, of these natural products that confer that characteristic, like of an oak tree, into the body. So that's the theory. Homeopathic medicine is older than our systems of medicine. Remember in England, probably 100, 200 years ago in England, homeopathic hospitals were much more prevalent than the newer hospitals. So a very old system of medicine. The only thing is with homeopathy, we don't have as much clinical evidence as we like here in Western Canada. Our Western Canada physicians are a little bit resistant to homeopathy, which I disagree with, but however, the evidence needs to come forward. These are scientific men and women who need to be cautious with you because they care about you and they want to see strong evidence first. But I know personally some homeopathic docs in Calgary who are trained as Western physicians and then moved into homeopathy. So there's fabulous practitioners in Calgary. So what's your experience? Do you want to share your experience of homeopathy or naturopathy? Something to share with the group? Oh, okay. No. Oh, okay. But that was a great question. Yes, sir.
Are any of these covered by health care?
Lots of them are. Yeah. Oh, healthcare like Alberta healthcare? Most of these don't have any costs. Let's look at these.
No, I mean the one you just finished talking about, where you will spend 2.5 hours with.
Sorry?
You talked about going to see this guy and you spend 2.5 hours with him.
Oh, a homeopathic physician, yes.
Is that covered under health?
Oh, good question. A homeopathic evaluation, usually the first assessment will be covered by Alberta Health Services, and any subsequent to that will be out of your own pocket. So it is a decision to consider, yes, because it would probably be at least $100 an hour to do a follow-up visit. Yes, so there would be some out-of-pocket costs. Sometimes insurance companies will cover those costs for you, depending on if you have insurance and how broad that insurance is. Naturopathy, same thing. Most health benefit plans will cover that. So does that address your question? Still a concern, hey? Well, I should let you answer. Do you have an insurance? Do you have some insurance coverage? Okay. Okay. So what you do instead, I'm glad you mentioned that, is you choose the things that have no cost. Like I'm serious. This is like what Mark Moyad would say. You can get as much benefit from some of these simple therapies that cost nothing as compared to buying a hypothetical natural health product. Like, save your money and do what works. Does that make sense, maybe? Yes, sir.
You spoke about antioxidants and the need to go off them during radiation because you need the free radicals. But free radicals continue after radiation and no one to attack cancer cells. How do you get this nice balance?
Well, there's a question. Free radicals are always produced in the body. It's not related to illness or health. It's actually... Yes, that's right. That's right. So let me get clear on your question. Can you re-ask your question, and then I'll just reiterate to the group too?
You said that you use antioxidants to get rid of free radicals out of your system, except when you have radiation, which I agree that is quite correct. But then free radicals are still in your body and should be, because they help to prevent other diseases by attacking the cells.
So your question is, how do we kind of solve that? How do you get a nice balance? All right. Let me clarify a few things. The slide or the debate about antioxidants is really the supplementation, so not the foods. So we're talking about supplementation. And I have studied this at length. And here's a study that you may, well, I don't know. I'll show you something. What I feel, what I would be doing is eating a healthy diet at all times, tons and tons of vegetables. And if my oncology team recommended that I stop or avoid supplementation during treatment, I would do so. So we can't interfere with our metabolism, really. It's going to happen. Free radicals are always being formed in the body, and like you say, they have a purpose. They have a purpose. The big debate about antioxidants during chemo, there's a paper here. It's by Ralph Moss. Now, I want to tell you about him. He is on your recommended website list right at the bottom. It's called cancerdecisions.com. And I don't know if you know the work of Ralph Moss. He was actually a medical critic. Well, no, he was a publicist at MD Anderson for many years, and then he left under interesting circumstances, and now he has his own consulting business. He's not a medical doctor, he's a PhD, and he is a medical critic. And he has a newsletter that I highly recommend you may be interested in reading, because he comments on the business of cancer and the economic aspects of what studies get done, how clinical trials are transmitted, how we communicate about them, etc. So anyway, should patients undergoing radiation and chemo take antioxidants? And is that a yes or no? It's not. It's so complicated. Certain types of cancers, there has been shown certain cervical and uterine cancers that supplementation during chemotherapy can benefit the course of chemotherapy. So it really comes down to, again, what I say with every patient who has cancer, every person who has cancer, is What type of cancer do you have? Prostate cancer, obviously. But what stage? What's your level of activity? What was your nutritional level before? What is your nutritional level now? Are you at a healthy body weight? Well, how often do you play tennis, etc.? I mean, those questions are individualized questions. So for you, I can't really answer. That's a long answer for not having an answer. So you and I we can talk together if you want to. But I'm sure you've sorted out according to just your own awareness of what your body needs. Yeah, and that's one thing that I wouldn't worry about. What I'd be worried about is, what is my physical activity level? What is my nutritional pattern? Am I sleeping well? Am I getting hugged? Do I have a pet? And you've pretty much got it handled if you handle all those things. Is that okay? Yes, sir.
I'd like to sneak in two, and one, what would you recommend? What would be your first or second recommendation for improving energy? I'm at zero energy.
Oh.
I'm weaning off prednisone, so that isn't helping, but an energy booster. And the second question is, do you have any good or bad opinion of probiotic yogurt for stomach being good?
Do you have an upset stomach?
Well, just a nervous stomach.
Nervous stomach, yes. So that's probably going to be a good thing for you. What's that? Oh, I'm sorry, yes. The gentleman asked the question, two questions. Energy level low, what's the best way to boost energy? Second question was my opinion of probiotic yogurts. And for anyone who has an upset digestive system, I do agree that those yogurts with acidophilus, bifidus can be really helpful. But you know what? There's more practical things that can be helpful for that nervous kind of stomach. So I know your fatigue is low, but is there a level of physical activity that you could do?
I do quite a bit of walking.
Oh, good, okay, yeah. So a level of activity that's enough to lift your energy and not drain your energy. So you have to figure out what that is. It's a delicate balance. Yeah. Are you sleeping well? Good. Well, because you're tired. But do you feel energized when you wake up? Okay, so there's a lot going on. We'll have to just talk together. Let's talk together. But the best things to build energy. Okay, I feel strongly about this, and I have to start because I know it's 9 o'clock. What is going to build your energy? What's going to drain your energy more than anything is to be doing something that you don't want to do. Honestly, if we could create something positive in the world, is a belief that I don't want to do it, I'm not going to do it. You shouldn't be doing anything you don't want to do. I'm serious. This is a health issue. The things that you do want to do are going to give you energy. You love playing with finger paints. That lifts your energy. You love writing. You love playing tennis. Those are the things that lift your energy. If your energy is being drained, I know you have an illness and the treatments are really draining. But your day-to-day activities, if you're doing something that you just feel, oh, I gotta do the vacuuming. Hire somebody to do the vacuuming, get a teenager to do the vacuuming, get your friend who says, can I help you? Yes. Can you come and do my vacuuming? Honestly, you have to ask for help. Only do the things that lift your energy. And a lot of things that take your energy down is our thinking about something. If you find yourself very, very fatigued, just stop for a moment and think about what you're thinking about. Change the thinking a little bit. Yeah. Two more. Is that okay, Karen? Two more comments, questions?
I'll give you
Yes,
an
sir.
observation.
Okay.
When I presented 3 years ago, there was a behavioral change for myself within a matter of a week that it took me a real time to realize. And it was that I'm a musically trained person, scientifically trained person.
Okay.
And when I got in the car, I do a lot of driving. I used to always have the radio on. I haven't consciously put the radio on for the last 3 years. Silence and visualization of my driving. But,
Wow. Really? So I don't know if you all heard what the gentleman said, but you're a musician and a scientist, always listening to music. But big changes behaviorally 3 years ago. You stopped so much automatically having the radio on in the car, right? So silence, feeling the calmness with it.
And driving through Oliver and just enjoying the sunset.
Wow. Being in the moment, being there, you see what's around you. Thank you for sharing that. You know, that's another thing that's very draining, is to spend a lot of time thinking about the future or the past. Honestly, what's wrong right now, other than you're really thirsty and you need to go to the bathroom and it's 9 o'clock? But basically, we don't need to worry about later or tomorrow or yesterday. It's really okay right now. For right now, it's okay, hey? Okay, thank you so much, Karen. Thank you. Thank you.